Men and women are equally affected by low back pain, which can range in intensity from a dull, constant ache to a sudden, sharp sensation that leaves the person incapacitated. Joining us to discuss from just up the road at Mayo Clinic in Phoenix is neurosurgeon Dr. Chandan Krishna. Good morning, doctor.
Good morning. Thank you for having me, Alex.
Of course, it's nice to have you on. So let's get to the heart of the matter. Why do so many Americans have back pain?
So it's very true. Back pain is fairly prevalent. According to one estimate, more than 80% of U.S. adult population at some point in their lifetime will experience back discomfort or back pain. However, it is very important to realize that most of these symptoms or discomfort are self-limiting, and they tend to resolve on their own or with conservative management. Now, what are some of the risk factors? Well, the risk factors are obviously age. As we age, our spine is also aging along with us, and that tends to result in some discomfort. We can have arthritis in the joints of the spine that can cause pain. The other thing is also what exactly the spine is supporting. So spine can be seen as a pillar that's supporting us. And if we are obese, then it has more weight to support, and therefore more wear and tear, resulting in pain.
Right, and there's a big difference, as you sort of alluded to, between that acute short-term pain and chronic pain. So,
as I stated before, we'll all experience discomfort at some point in our lifetime. However, if the duration is rather short, between 4 to 6 weeks, and it resolves, then it's not a big deal. However, a small fraction of the population or the patients experiencing discomfort can progress to experience the chronic pain, which is past 10 to 12 weeks. At that point, you should definitely consider seeing a primary care physician, who in turn will order further tests in terms of perhaps X-ray or MRI to look for the underlying etiology.
Well, and once they do that and they determine that there's something that they can fix, what are the options for treatment that are maybe minimally invasive?
So as you alluded to, when people have pain which are from, let's say, herniated disc, what patients oftentimes describe as sciatica-like symptoms, which is a sharp shooting pain down the legs, it's caused by a small herniated disc fragment. What we can do is make a small incision, usually about a centimeter, maybe 2 centimeters at most, and we can use a microscope and go down the spine and find the free fragment or the herniated disc, which is causing the compression on the nerve, resulting in the pain. We can remove that fragment, and this surgery is routinely done as an outpatient, and you can go home the same day.
Got it. And so in the last 30 seconds or so we have left, what are some proactive steps that we can take to prevent any type of back pain or to minimize it?
Absolutely. So what I routinely tell my patients is to have a good posture. I know this cannot be overemphasized, and also to remain active. As long as we remain active, we have good posture, and we watch our weight, I think those will be the ultimate 3 things we can do for our spine.
Got it. Well, remaining active, like you say, doesn't have to mean that you're the star athlete every single week running 4 miles a day. Even just 20 or 30 minutes a day, I think, is what I've heard from doctors, is more than enough to keep you active. So, Dr. Krishna, if people want to learn more information, where can they go get it?
Well, we have an immense amount of information on Mayo Clinic's website. Feel free to visit us at mayoclinic.org, and you'll find all sorts of information about back problem and others.
Very good. Dr. Chandan Krishna, thanks for your time today.
Thank you, Alex.
Absolutely. Stay right where you are. We'll be right back.